of motion over a period of time actually do have a decreased risk of Alzheimer's disease. And in fact, here's a study way back in 1997 demonstrating that those people who take non-steroidal anti-inflammatory medications have a dramatically reduced risk, 60% risk reduction of Alzheimer's disease. Interestingly, the risk of Alzheimer's is increased in people who take acetaminophen or Tylenol over a prolonged period of time, 35% increased risk. Now, why might that be? Well, our knowledge base so far tells us that Alzheimer's is a disease characterized by excessive free radical activity. Acetaminophen blocks in the body the production of a very important antioxidant called glutathione. How many people here have heard of glutathione? Okay, wonderful. Even beyond Alzheimer's disease, we run in fear of Parkinson's disease, which we now know has a very powerful environmental component. In the Wall Street Journal just a week ago, there was an article talking about this link between exposure to pesticides and Parkinson's. And that's really brand new news. I mean, that was only first published a decade ago. But nonetheless, we know that the same issues apply to Parkinson's, that if you've taken non-steroid anti-inflammatory medications which reduce inflammation, your risk of Parkinson's declines. If you measure what are called cytokines, these inflammatory mediators in brains of, actually in the cells of the brains of Parkinson's patients, you see that they're dramatically increased compared to normal. This is an inflammatory mediator, and this is in the normal situation, this is in the Parkinson's patient. Huge increase. So it really tends to support this whole idea that when we see an Alzheimer's patient who is struggling, whose brain is declining, month to month, year to year, there's a fire upstairs. Their brain is on fire, his or her brain is on fire. Our task is to put the fire out. I often lecture to groups of Parkinson's patients, and I ask the group, how many of you here are taking medicines to treat your Parkinson's disease? And most of the people raise their hand, and I tell them, you know, in reality, none of you really is taking medicines to treat your disease. You're only treating symptoms with your Mirapex, your Requip, and your Cinemet, or whatever else you may be taking. That's treating the smoke but not the fire. Treating the fire is putting the fire out with things like coenzyme Q10 and other antioxidants. When I speak to Parkinson's groups, it's oftentimes difficult because I always like to open with a joke. And you tell your best joke to a group of Parkinson's patients, and they have what are called masked faces. They never really smile that much. I mean, you just stand there and it's your best joke. Group of Alzheimer's patients, it's okay because a lot of them don't understand the joke, so you don't understand that. I think the most challenging group I found out recently is I lectured to a group of people with OCD, obsessive compulsive disorder. And I thought the lecture went really well, but then afterwards I started getting letters, and they keep coming and coming and coming. Well, what puts us at risk for inflammation in the brain? A variety of things. We know that we can be genetically predisposed, which is really coming into its heyday at this time. Head trauma, being hit repeatedly in the head, is associated with increased production of these inflammatory chemicals. Can lead to things like Parkinson's disease. Look at Muhammad Ali. Vascular disease, the small strokes that people experience are related to elevation of something called the C-reactive protein, which should be part of everybody's physical examination. Environmental insults that we're going to hear about later this afternoon when Dr. Ray speaks. Obesity and diabetes, rampant in this country. Obesity turns on inflammation in the body. It's probably the most important reason why obese people are at increased risk for Alzheimer's and coronary artery disease. And we live in a very, very obese country, the most obese country on the planet by far. And, if you really want to see what it's like, you travel to go to a major airport. Yesterday I had the opportunity to visit 4 of our country's major airports, and that's not a joke. I went from, crisscrossed the United States yesterday because of one of the airlines decided to cancel a flight. Nonetheless, when you walk through like the Chicago airport, you see just massive numbers of obese people and signs that say terminal. So I am going to say that when you come to Aspen Airport, you don't see that. I was totally amazed, and it was really heartwarming to see how people here are in great shape. So it's true. So these things all lead to inflammation in the brain. I mentioned just a moment ago C-reactive protein. This should be an important part of your physical examination each year with your doctor. You can lower C-reactive protein, and it's dramatically related to increased risk of Alzheimer's. If your C-reactive protein is elevated, your risk of Alzheimer's can go up as much as 300%. So you should know your C-reactive protein level. How many here have already had your CRPs checked? All right. That's a large number in an audience. How many here have had their homocysteine levels checked? Wow. Word's getting out. When you look at the reference back from August of 2002, you see that as you have the highest level of C-reactive protein, your risk for what is called vascular dementia, which really runs hand in hand with Alzheimer's, it's really not appropriate to tease them apart, is increased by about 5-fold. So we need to know our C-reactive proteins. You can lower C-reactive protein by the types of oils that we're talking about earlier this morning, and even simple magnesium. In the American Journal of Clinical Nutrition, there was an interesting article recently that showed there's a direct correlation between low levels of intracellular magnesium and elevation of C-reactive protein. So, at the end of the day, what we're left with is this flow diagram demonstrating that if you have inflammation for whatever cause, we'll talk about where it comes from, you turn on free radical activation, and that leads to neurodegenerative diseases. That's the fundamental of neurodegenerative diseases, whether we're talking about Alzheimer's, Huntington's, which has a genetic component, Parkinson's, multiple sclerosis, the brain is on fire. We're going to learn this morning what we can do to keep the fire from starting in the first place, and then if it has started, how to put the fire out. Well, what are the factors that are involved in inflammation? This is a very big issue for our country. Not that Jack Nicholson is acting his age, but that we have a huge number of people with diabetes. There's a direct correlation between having diabetes and having increased risk for Alzheimer's disease. Probably closer to 20 million Americans are diabetic, with at least twice that number being so-called pre-diabetic, or having issues with how their body responds to insulin. They say that 1.3 million cases annually, incidence is going to double by 2025. And the annual treatment cost is $132 billion if you just focus on diabetes. But if you also included the risk of coronary artery disease and Alzheimer's disease as being increased by diabetes, then that number obviously would be a lot greater. This was published July 24th. Today is the what? 27th? Is it 27th, 28th? Something like that. This says the Alzheimer's diabetes link. So the word is really getting out that if you're diabetic, you have a dramatically increased risk for Alzheimer's disease. And diabetes is a preventable disease. And this is the rates of increase in diabetes going back to from 1980 up to 2004. You would hope maybe the Dow Jones would look like this, but this is the incidence of diabetes in the United States. It's a crippling disease, and it's preventable. Well, why is diabetes such an issue for your health, and why is it important for me in terms of the brain? When your blood sugar is elevated, it changes proteins in your body. We call that glycooxidation. That's a fancy term, meaning that sugar binds to protein and changes the appearance of protein and how that protein behaves in your body. And it forms what are called advanced glycosylated end products, which means that proteins are bound to sugar. Interestingly, this is related to the aging of our tissues, and look at the acronym AGE. So it kind of is an easy way to remember that. From the Journal of Neurotransmission, looking at Alzheimer's disease as a synergistic effect of glucose deficiency, oxidative stress, and these what we call advanced glycosylated end products. We measure advanced glycosylated end products in the simple test that any diabetic has probably heard about called glycohemoglobin. That's a way that we measure control of diabetes over a 3-month period of time. The more sugar you have floating around in your bloodstream, the greater the sugar binds to protein. We can measure that. It's an average measurement. But they talk about the fact that these advanced glycosylated end products can lead to turning on of cytokines, which are the mediators of inflammation, which then leads to free radical production. So that is the downside of changing our proteins by having them bind sugar. It turns on inflammation. When you look at what that might do, it increases the production of free radicals by 50-fold. That's what, 5,000%? So the free radical production in a person with elevated blood sugar increases dramatically. It's why diabetics desperately need high levels of antioxidants. they further call to our attention the fact that maybe pharmaceutical approaches in the future could focus on this oxidative stress and reducing inflammation. This offers opportunities for the treatment of Alzheimer's.